Hey everybody, welcome to this Facebook Live with two of my good friends that I'll introduce to you in just a moment. But as we get started today, if you would like to tell us where you are watching this from, we want to know. So tell us where you're at, and if you have any questions that you want to send in. I have a stack here that we're going to try to get through, but if you want to add to it, we'll try to get to it in this time, and if not, we'll respond to you personally, make sure that we can answer as best we can. So today, I am really privileged to have my good friend John Leyerle and Dr. Clayton Chau. And I want you guys just to introduce yourselves to our audience, tell them a little bit about yourselves, and then we'll dive into about your passion for mental health. So first, just introduce yourself, John.
It's okay. What a pleasure it is to be with you here today on Facebook. My goodness, I hope we're able to do some sharing with folks and answer their questions.
Yep.
So I'm blessed to be the president of the National Alliance on Mental Illness, the Orange County affiliate. I've been the president for the last 2 years, but connected with NAMI for a couple of decades. And such a passion for mental health, and we'll get into that more here in a minute.
Yep. But I had never heard of, some people say NAMI, some people say NAMI, tomato, right?
Absolutely.
So I say NAMI, you say NAMI. I probably should say it your way since you're like the president guy, but I'm used to saying NAMI. But I never heard of NAMI until a few years ago, which is one of those things that is mysterious to me because NAMI is this huge. Tell us just a little bit about NAMI.
So NAMI has been around since 1980. It's the nation's largest grassroots organization supporting families and peers in their mental health journey. Okay. So it's grassroots because we involve a lot of volunteers, a few number of staff, and some members of the board of directors. Our passion is to deliver education, support, and advocacy to folks in their journey. And I would say that we're proud to be able to do it with evidence-based practices that really make a material difference for folks.
And it's free.
And it's zero cost for the participants.
That is amazing because as somebody who has a son who had a severe mental illness, all the hours that I spent combing through the internet trying to find resources through the years, those of you who are parents or family members, you know this story, you know how hard it is to find good resources. And that's what's amazing to me, amazingly sad, is that I didn't know about NAMI. And since Matthew's passed away, I have learned about NAMI. They're free resources. I can't recommend them highly enough. It's an amazing group, and it's just really a privilege to have you with us today,
Well,
John.
thank you so much.
Thank you. And then we'll come back and you can tell us a little bit more even about why you're so passionate about this. But Dr. Chau.
Hi, good afternoon, Kay and John. Hi, everyone. It's such an honor to be here to have this conversation with the two of you. By background, I'm a trained psychiatrist and psychologist. Been passionate about the mental health field, obviously. I've chosen this as my career life. And I think foremost is I'm someone in recovery with depression and post-traumatic stress disorder, as well as having a strong family history of relative with depressions and
so it's personal to you
as well. Yes,
it's very personal to you.
Absolutely. Currently, I work for a large health system, Providence St. Joseph Health System, as their regional executive medical director for Southern California.
Great.
And I'm also a clinical advisor for Wellbeing Trust, which is a new nonprofit organization that are trying to elevate and facilitate the conversation in moving our nation towards completely emotional and spiritual well-being. So
I have a feeling I'm going to have to tell you to talk a little bit louder. I'm already thinking that people are going to be going, wait, what did he say? So
we'll try to speak.
Yes, just got to use your big voice.
Dr. Chau has so much good stuff to say.
Yes, he does.
We want to hear every word.
That's right. I want to make sure
kind.
people have. So just circling back around then, John, why did you get involved in NAMI? Why are you in the National Alliance of Mental Illness? Why does that matter so much to you?
It's because of my passion. And how did my passion occur? I identify with multiple family members with mental illness. And in fact, probably the one that is the greatest inspiration to me is my mother-in-law, who has since passed, Sylvia, with a diagnosis of paranoid schizophrenia. Okay. When I first met Sylvia in my 20s, I knew there was something different about her, but I didn't quite understand what it was. I had stigma regarding mental illness. And over the years, as I bumped into NAMI through my church and one of their signature programs, Family to Family, I got many aha moments. I got a toolbox of understanding, empowerment about mental illness that melted my stigma. and gave me insight to Sylvia's journey. And so not only was I empowered by that program, but later I said, I want to learn to be able to be a co-teacher of one of those, and actually several programs. And so I've been teaching for a number of years, NAMI programs, was invited to join the board some years ago and was elected president 2 years ago. So it's a natural, as Dr. Chau said, it's a personal thing for me. I'm very connected, and this for me is my mission.
I love that. Let's just do this now. I was going to say, tell us you mentioned the family to family. I was going to say, we'll come back. Just tell us briefly what the family to family program is, because I think so many people, if you've not heard of it, it is one of those, like, stick your big toe in the water and learn about mental illness if you have a family member. So tell us about that, John.
For sure. So family to family is one of about 7 or 8 signature education programs that NAMI offers. The family to family program is meant for family members who have a loved one who's 18 or older with a mental health condition. Family to Family has 12 separate classes. It tends to meet one night a week for about 2.5 hours. Over those 12 weeks, it's 30 hours of curriculum. The program material was developed by a NAMI leader, Dr. Joyce Berland, out of her lived experience. And it includes topics like, what is a mental illness? How is it diagnosed? How is it treated? Communication techniques, problem-solving techniques. All 12 of the classes are my favorites, but I'm fond of saying one of my favorites is one that's so empowering. It's a class on self-care. That class not only says it's important to put your oxygen mask on first, but it's okay. As we live in the mashed potatoes circumstance of our loved one's mental health journey, it's not only okay, but it's necessary. That family-to-family class provides a notebook full of materials, 2 co-trained NAMI teachers that present the curriculum, and the class tends to really bond. One of the messages that becomes clear is we're individually not the only one. There's others on this journey with us.
So reassuring. I mean, I'm sure that patients and patients' families talk to you about that all the time. That sense of feeling alone.
Right.
Yeah.
Right. It's not only the patient, lack of a better word, the individual living with mental illness feeling alone, but most of the time their family also feel like they're alone. Particularly when you talk about ethnic family, right?
Yes.
When the stigma is huge. One thing that I might want to add, John, is that the curriculum that you talked about not only is in English, but it's also been translated to various languages like
That's
Spanish,
good to know.
Chinese, Arabic,
That's good to know.
Farsi. Let me see, there's one other that we did that here.
English, Spanish,
and Korean.
Korean, I was going to say Korean.
So they are available. And then, folks, if you are from outside of Orange County and you're interested, you can contact John because it's the credit of NAMI Orange County and the County Department of Behavioral Health. We participated in translating and made it available for family that have limited English capacity.
Where would they find that online?
So the place to find it is to go to www.nami.org. That'll connect you with NAMI National, and that'll give you a link to all of the NAMI affiliates. There's over 600 like NAMI Orange County throughout the United States. And you can link up, find out when the programs are delivered in your community, and go receive the benefit of them.
Well, as I said, I love NAMI, and not just the classes that they offer, but just the information. Their website is chock full of information, and it's all good. It's written for lay people like me, people who don't have a doctor, who aren't a physician, don't have a medical degree. It's just written in language that's easy to understand. It's very accessible information, and I just can't recommend it highly enough. I want to circle back around. This wasn't one of our questions, but you raised an issue that is a critical one to me, and that's in communities of color. Right. How mental illness is perceived, maybe how the stigma is perceived differently, how families react to even the possible thought of mental illness. Can you talk to us a little bit about that?
Sure, and I think in the ethnic community, and I can speak to the majority of the Asian and the Latino community, mental illness is not something that we talked about. Not like we talk about in our Caucasian family.
Right.
I mean, here there's still that stigma.
Right.
But for the other culture is even worse, right?
Sure.
And I think it's because, number one, lack of knowledge.
Okay.
Number two, there's not been information widely available in their language, so
Yes.
that makes it very difficult.
Yeah.
And number three, there's perceptions of people with mental illness usually described as crazy,
Right.
a general term,
Right.
but not acknowledging that there are different type of mental illness in the continuum, and that people with mental illness could recover
Right.
and function quite well integrated in the community. So there's this not understanding of the capabilities of individual leading to lack of hope.
Yes.
And I know we will talk about that in
Right.
a second.
Right.
Right.
And so people tend to be isolated. Family tend to be much more isolated, especially in community where family is a very important part of the community.
Yes.
Right. There's other society, other culture where individuality is
Right.
not so much pay attention to as we do that here in America.
Right.
Whereas the family and community
The
is
group
the
is
big-
more important
yes.
than the
And
individual.
so that group dynamic created much more isolation for family that with children or loved one with mental illness.
Yeah. Thank you for talking about
You know,
that.
I'm mindful of a
ahead.
comment, if I can interrupt for
Yes,
a second,
please.
that Rick has mentioned on a number of occasions when he delivers his message to us.
That would be my husband,
Rick Warren, yeah, they're one and the same.
Just in case you didn't.
So, and this is two thoughts on stigma reduction, that our chemistry, our neurological chemistry, is not our character.
Right.
Our illness is not our identity.
Right.
Those are truths that are so important to take forward and to understand to help reduce the stigma of mental illness.
In any community. Go ahead.
And the other piece that's important is that mental illness doesn't discriminate.
Yes.
Right?
That's
It
right.
really doesn't discriminate who you are, rich or poor, educated or not,
Right.
and color.
Right.
I mean,
Well, then we should also acknowledge, with regard to that, Dr. Chau, that in our lifetimes, across the planet, half of us will be impacted by mental illness. Think about that for a second. What does that mean?
I didn't believe that statistic the first time I read it. You might just say it again in case people didn't.
Half of us
They might
in
not
our
under-
lifetime
They might think that you were exaggerating.
will
but
be
this is-
impacted by
yeah.
mental illness. Half of planet Earth. What does that mean? That means half of us will either have a diagnosis of a mental illness in our lifetimes or have a loved one or a dear friend with a mental illness. I identify with multiple family members with a mental illness. So it's a pervasive thing.
It sure is.
And there's more that we can learn about it, to destigmatize it, and to open the doors of hope and wellness in recovery.
I think, Dr. Chau, just the fact that you, as an Asian man, are very open about, you just mentioned it, and I'm sure there was more if you wanted to tell us, but not necessarily, but just about your own story. But just the fact that you have disclosed that has got to be both very frightening, because, as you said, communities of color, ethnic communities, it's not an open topic. So how did you ever kind of have the courage to be able to start sharing your story? I think that helps bring down the stigma and the shame in communities when people in those communities speak up. But that had to be a scary thing, at least at some point for you.
yes, in the beginning it was very, very difficult because I've watched and treat many patients who struggle and the families struggle, right? Discrimination varying from if you have a child in a family with mental illness, the other children have lesser chance of getting married because other family are afraid to marry into this family, right? This concept of genetic transfer of mental illness and what does that mean? And I watch family become isolated from the community. Not that the community would outright discriminate, it's just that they don't know.
Right.
And they just need that sense of understanding because
Yeah.
I believe that as human beings, we're all very passionate, right?
Yes.
We're all very given towards the other, especially those in need. I think that the perception is not there, that education is lacking, and therefore we created this isolation. So I started to speak out. And in the beginning, it was very difficult for a patient and family to hear that. Your provider said,
Right.
he has this.
Yeah. You're the
To me,
physician.
yes.
You're the physician, and you're saying,
Yes.
I've struggled.
Yes.
Yeah.
But to me, it's no different than a doctor said, oh, I have high blood pressure and I also have diabetes when he or she treat her patients, right? And so I just had to do it. And to go into the community and speak about recovery, you have to have example. You can't just say, yes, people recover.
Right.
Well, tell me who they are.
Right.
So
That's right.
I find that most people are very surprised. All people are very surprised when I said,
Yeah.
okay, so I'm a physician. I've struggled with depression and PTSD all my life. But because I was fortunate to have a lot of people who support me,
Yeah.
from clinician to family members
Yeah.
to friend, here I am.
Yep, here you
So
are.
that's recovery.
Dr. Chau's message is so empowering.
It is.
He is, I know from my professional connection and my friendship with Dr. Chau, he's a gifted psychiatrist, perhaps one of the most talented that I know.
You're so kind, John.
He reveals to us that
Yeah.
he's also a human being.
Yeah.
And so we can connect with this incredible talent and know that he has deep empathy.
Absolutely.
It's tremendous.
Well, I'm just thinking of one of the complaints that people say to me frequently is that their provider, their physician, their counselor, whatever, is not necessarily a person of great empathy or compassion. Sure. And I remember Matthew, it was probably one of the things that made him the most angry and caused him to lose hope often was to talk to a mental health professional that he felt like didn't get it, who didn't understand, who didn't really have compassion. And it made him not want to stay in treatment. And so actually it feels like to me that maybe some of your, the folks that have come to see you were initially a little disconcerted to know that, that you struggle or struggled with depression, PTSD. But on the other hand, I can't help but think of the hundreds who walk out of your office feeling like he gets me, he understands me. And what joy that is. I mean, because we all want to know and be known. And if you feel like the person who's providing you care and treatment gets you and knows from personal experience, I can't think of anything really much better in terms of treating and helping people find their own path to recovery.
Yeah. And actually, my goal is actually giving family and individual hope. One of the things that I'm most proud of, and it gives me such satisfaction, is seeing young patient whom I sort of mentor.
Yeah.
And it is very hard to hear your treating provider mentoring you, right?
Right.
But I've gotten patients now who graduated, become physicians, a few went into psychiatry, dentist,
Yeah.
a lawyer, a social worker. That's how I see it.
Yeah.
Right. That you have mental illness.
Right.
That's only a part of you.
Right.
There's the other part, the other dream and hope that you've had. All of us had that when we were very young. All of us inspired to be somebody. Right. And because of the mental illness, sometimes people get robbed of their potential. And I want to do that. I want to bring back that hope, bring back that inspiration, so people realize that they can't fulfill their life, whatever it is that they want to be.
So if you're, sorry, did I interrupted you?
No,
okay. I was going to say, if you're just, tuning in, you're just starting to listen to this, watch this, if you have some questions for us, send them in, please. Let us know where you're from, where you're watching from, and then send them. If we can't, we've got the stack. We're trying to work our way through them, and if we don't get through them, we'll try to answer offline so that you get the answer to your question. But, we've been talking just in this last few minutes about children. You mentioned, that you had struggled since childhood. You said all your life, so I'm assuming basically childhood. I know that I've lived with low levels of depression my whole life. Matthew was diagnosed at 7 with depression and then a whole host of mental illnesses. And I frequently say Matthew probably would have been diagnosed sooner, except for I didn't know that children could even have a mental illness. It didn't even occur to me that would be what was behind his struggles. And so the statistics tell us that 1 in 5 children have a mental illness, and that half will be diagnosed by the time they're 14, another 25% by the time they're age 24. So how can parents who are watching, how can they tell the difference between normal childhood, either a period of struggle or just they've hit a rough patch? How can you tell the difference between what's normal in childhood development and you might need to pay attention that there's something more serious at work here? I don't know if you want to, which of you want to start
you want to take
that?
it first and then I'll jump in?
I think clearly every child is very different from the next one, right? Different in temperament, different in how they relate to family. But American, we have this saying that monkey see, monkey do.
Yes.
And I really, really believe in that, regardless of, from the clinician point of view, regardless of which theoretical orientation you prescribe
Right.
to. Nevertheless, that modeling is so important from parents to children, right? And so I want to give a plug that some parents say, I want to be my children's friend. I said, no, you want to be your children's parents,
Good.
right? You need to do that. And being parent is being aware and being supportive and being loving to your children, right? So I would say if your child is falling behind school, if your child certainly become isolated, if your child's having difficulty with sleep, if your child is not eating, and if your child appear anxious, that would be some signal that you need to take your child to the family doctor, the pediatrician, to be evaluated.
Okay.
And don't take it lightly.
Okay.
Right.
So how do you know what's the difference though between? So would you give them a guideline like on time frame? The first time they appear anxious, does that mean that they should take them to the family?
No.
Okay.
But
So-
you need to sit down with the child and talk it out. Sometimes it could be situational.
Right.
If the child says, well, there's nothing changes in school, and of course talk to the teacher, right? Sometimes kid who's being bullied, afraid to tell their parents, but the teacher should know, their friend should know,
Yeah.
right? So know your child, know their friends who they hang out with, and know their teacher. I think we don't realize the importance of working collaborative with the school.
That's good.
How important that is.
That's
right?
good.
Because on the average, a child would spend 7 to 8 hours a day in
Right.
school and not with you.
Right.
And depends on your daily activity and your work.
Right.
You get home, you get tired. The most you would do is push them to complete homework and sit with them. And I tell parents, sitting with your child doing homework or shuffling them around doing sport game or tutoring is not quality time with your child.
That's good. Oh, would you please say that again?
Yeah.
Look right into the camera and say that, because I
Yes.
really think that
Yes.
is a key message parents
Yeah.
need to hear.
Sitting, doing homework, shuffling your child around to ball games or tutoring, those are not quality time. Quality time is spending one-on-one, having conversation, doing things that's not chore,
Fun.
doing things that's fun.
Yeah.
That's correct.
Yeah.
But have that emotional
Yep.
connection and understand your child is very, very important. And I think because of what's going on in terms of the school system, a lot of children are pressured
Right.
into doing way too many things. And the parents feeling that way as well. And not able to have the time to spend with their children. That is the fundamental of
Such a
child
good word.
rearing. We have to do that.
So, Dr. Chau,
Go ahead, John.
I hear you say that as we connect with our children, we know them.
Yes.
And as we begin to perceive some differences
Yes.
in their lifestyle, in their behavior, in their interaction with their friends,
Yes.
it begins to raise indications that there may be the possibility of something that is hard for us to understand and maybe accept because of stigma, the
Right.
possibility of a mental health condition. So NAMI has a way to help further with that.
Great.
Another of our signature education programs is a program called Parents and Teachers as Allies. And the name of the program tells it all.
Yes.
Yes.
It's a program that is meant for parents and for teachers to get insight to typical behaviors of middle school and high school age kids. And when those behaviors get beyond the normal range, into the range where there may be a concern, and then the program also gives them insight to connecting with resources. As you identify the possibility that there may be a mental health condition, they can then connect with resources and get a fuller insight.
Yeah.
And to begin the process of appropriately responding to that condition. We mentioned a moment ago hope, and hope is my favorite four-letter word, and perhaps hope will come up in some of the other questions.
Sure, it is.
But one of the hopes that you can take to the bank
Yeah.
is that the sooner the possibility of a mental health condition is identified and the sooner effective treatment begins, in every instance, the better the outcome.
Absolutely. And that's not just your opinion. I mean, studies have shown that. I mean, there's evidence to prove that that is not just a nice thought, but it's actually true, that there are better outcomes when people get treatment sooner.
Profoundly so.
And there's another person who's equally important in this equation, and that is the pediatrician. Pediatrician, by training, by regulation, by law, however you look at it, are required to screen a child on an annual basis on a set of evidence-based screening tools.
Yeah.
Right. So, if your pediatrician does not do that, it's time to change to a different pediatrician.
Good word.
Right. And then you need to have this connection with the pediatrician. Question, contact, relate information to the pediatrician is very important.
Sure.
Because they are the one who know
Right.
the scientific side of child development.
Right.
They should know,
Right.
and they are trained to be on the alert if there's anything out of the normal range.
It raises
and I hate
a
the
red
word.
flag
It
for
raises
them.
a red flag.
Yeah.
And then they would need to also talk to you as a parent and talk to the school teacher, etc.
That's
So
great.
the
That's
category
the
I hear Dr. Chau speak to is a very important category for NAMI. It's called advocacy. So for me, advocacy is the ability to learn something, to be able to apply that in a way that's meant to be beneficial. And most often, when we individually have a circumstance, our best advocate is not ourselves. It's someone who's close to us, who loves us. So as parents, as caregivers, become better informed about even the fundamentals of
Sure.
mental health conditions, they can become more effective advocates for exactly what Dr. Chau just mentioned.
And for that early intervention that we
Yes.
were saying is so important. I'm going to ask you another question here, but just something you said a few minutes ago when you were talking about, it just resonated with me when you were saying that urging your children to finish their homework is not quality time. A few years ago, we asked questions of our junior high and high school students here at Saddleback Church. Just tell us about your family. Tell us about your interactions with your parents, trying to get a handle on what it is that kids were thinking about, their families. And one of the things that came up really surprised me was the number of students who said, "I know my parents love me, but they don't have time for me." And this is the generation where the parents are driving them everywhere. So it's not that they're not being shuffled to sports games or to dance lessons or to tutoring, or that the parents aren't helping with homework. But the kids went on to say, "I feel like they're wrapped up in their own world and they don't really have time for me." That was one of those messages. I mean, it was like a knife in my heart to think of probably all the times with my kids. I love my kids passionately and always wanted to be a really good parent, but probably the number of times where I thought I was doing okay, and if you'd asked my kids that question, they might have said, "Yeah, I know my mom loves me, but she's really busy right now. She's really stressed about this, or she's anxious about that, and I don't feel like I've really got her attention." And just that has stuck with me as one of the things that we can do for our children's overall well-being and mental health, their sense of well-being in the world, is to spend the kind of time with them that is not just caught up in tasks, but is caught up in that connecting that you were sharing.
Yeah, and I think, to be fair, we're living in a world where everything is so fast-paced.
Yes.
And depends on where you live in the country and
Right.
the world. There's economic difficulty, right? Parents tried their best, tried their hardest to earn money, to put food on the table, roof over their head, right? So I think we have to move to a community movement now.
Yes.
How do we, as a community, together support family
Good word.
in doing this,
Good word.
right?
Yep.
Whether it be a family who living at the poverty level or even very well-to-do family,
Yeah.
right?
That families aren't just isolated
That's
in and
correct.
of themselves.
They are part of this
Yeah,
community.
part of a community.
So how do we come together
Yeah.
to grow that?
Yeah.
Because someone said it takes a village to raise a child. It truly
think she was
does
right.
take a whole village
It
to
does.
raise a child.
Yeah.
Healthy child, right? And because the way I see it, these are the leaders of our country, of our nation.
That's right.
What is the foundation? What is the basic foundation that we want to give them? Is it that we want to create hardcore, competitive leader who are out of touch emotionally with who they are,
Yeah.
with themselves,
Yeah.
and with their family and with their community. That's the choice we have to decide as a community.
That is such a good word. I love that. I'm going to think about that one. So let's switch to a little bit of a different question. Someone has asked, how can I get my loved one who isn't willing to get help or how do I help my loved one who isn't willing to acknowledge that they have an illness, or if they do have an illness, that they won't take their medication, they don't keep their doctor appointments? What do we say?
Sure.
So that topic is actually specifically addressed in the family-to-family curriculum, again, prepared by Dr. Joyce Berlin, drawing from a wealth of her experience and lots of research. So in the class on problem-solving techniques, we spend a lot of time on that, and it's so powerful. But Dr. Berlin says, at least on its face, there are two unsolvable problems. And you've captured them both. Let me speak to that, but then apply hope to it as well. Okay. First, we can't cause our loved one to have insight to their mental health condition if they don't have insight.
You mean I can't just say it louder and they'll get it?
There's a condition called anosognosia. It's a big word. It refers to the fact that 80% of us with a diagnosed mental illness have, by the condition of our illness, no insight to our mental illness. When I share that with the classes I get to teach, I always pause and say, when I get to heaven, I'm going to ask the good Lord why you set it up that way, because it's already so hard.
Sure.
And I've had dear friends and family members who have no insight, and some dear friends and family members with insight, part of the 20%. So that's a tough nut to crack. The other unsolvable problem that Dr. Berlin refers to is you can't cause your loved one necessarily to take their medication if they won't. Now, having said that, certainly there are things that we can do to influence both of those. And those include becoming educated and empowered ourselves, to be advocates for our loved ones, to share our perspective, and to really leverage our relationship with them to say...
Now tell us what you mean by that.
Well, to say, I love you, I know and understand where you're coming from, and I want to share with you part of where I'm coming from. And connecting on a relationship level, if we don't have that intellectual connection necessarily, if I don't have insight to my mental illness, but I have love for my loved one, for you, I'm going to be more inclined to sort of lean in the direction that you would urge me to go. With regard to the taking of my medication, if I have a diagnosis, you might, as part of the communication skills class in the family program, you might learn as my loved one to create expectations. To say to me, John, I love you. I notice that you're not taking your medications. And part of what I need to have you do is that. And if you don't, then the consequence will be this, in a loving, caring way. I think those two perspectives can move the challenge of the question that was asked.
You know, let me push that just a little bit, because, not push back against it, just kind of amplify that question. Because of the lived experience that we had, where Matthew had a severe mental illness. His was, increasingly as he got older, just more and more diagnoses were added to his conditions, and it got to the place that might have worked in earlier years, but the more his illness progressed, the more that there was no consequence, it felt like, other than the removal of the relationship. And by that point, he was suicidal. And you guys, I hear this. I get emails. In fact, I did a Facebook post a couple of weeks ago because the question came to me several times in 1 week through my email. I feel like that I've got to prepare myself for the fact that my son, my daughter, is probably not going to make it. That their illness is so severe. Several of them also had a substance use disorder, and they were just barely squeaking by. And these parents were writing me in grief, saying, I'm preparing my heart for the fact that I may lose my child. And so, just from my own experience, and then hearing this constantly, you must hear this a lot as a psychiatrist, when people say, I've tried all of that and the only thing left is to pull myself out of the equation. And yet, if you think your loved one might take his or her life, the last thing you want to do is to have that on your conscience that you pulled yourself out of a relationship only to have them die. I mean, it's, for me, when I think about particularly severe mental illness, it just creates these untenable situations. They're like, there's no good answer. It feels often like it's just a choice between bad and worse in terms of what families do. I know you guys don't have like the magic answers.
I have a
but
couple
just,
thoughts, but
yeah.
I want to invite Dr. Chau's insight.
Yeah.
So I will share my approach with how I work with family and their loved one with mental illness. So first of all, taking medication. Well, first of all, the number one thing in America, at least, we must acknowledge is that the civil commitment and the right to refuse treatment, especially when it comes to mental illness, is very strong.
Yes.
That's the bottom line.
Explain what you mean by civil commitment.
Meaning, just because someone have a mental illness and they are talking to themselves, they're not taking care of themselves from the perspective of the community, it doesn't mean that you can force them into treatment.
Okay.
There's only 3 ways that you can temporarily force someone into treatment or hold them into treatment for 72 hours. And you and I know that is if they are currently in imminent danger to themselves, to other, or they can't take care of themselves.
Yeah.
And can't take care of themselves, meaning they can't avail themselves to food and shelter, which translated very loosely, right? If someone said, yes, if it's raining and it's sunny and it's cold, I can go under the bridge and stay warm and stay out of the rain. And if I'm hungry, I can go and behind the restaurant trash can and find food. That, from the face of the law, is translated as, yes, you now
can still
how
take
to
care of yourself.
avail. Yes, which is unfortunate.
Right.
Very unfortunate. So just because I am talking to myself, actively psychotic, or whatever condition that from a community perception, for society's perception, that's just not normal.
Yeah.
Doesn't mean that you can force me into treatment. And that's why we see a lot of people who are homeless with mental illness because of that reason.
Right.
The issue of compliant, I like the word adherent better than compliant, is also another issue to tackle. How many of us actually very adherent to treatment when we are prescribing antibiotic 2 weeks for an infection, or we need to take hormone or what have you? Not very well.
Right.
In fact, there's a study at, I think it's Harvard, who did a study where they look at the professor and graduate student who have, and tell them, if you have diabetes, here's the consequences of untreated diabetes. How many of you will be adherent to treatment 100%? And the number was significantly low. And you will be very surprised. These are very educated people. And to them, adherence is also an issue, right? And then add to the anorexia, the inability to know. But I think the other component of it is stigma. It's very hard for people to accept that they have a mental illness. So if taking a pill is reminding me that I have that condition, no wonder why people don't.
There's resistance to that.
There's resistance to treatment, right?
Yeah.
So there's multiple plans. So I've always tell family, the best thing you can do for your loved one in this situation is creating hope. And by that I mean, and I know there's a lot of family get caught into the different diagnoses. What is it? To me, from a provider side, medication now are very effective. And yes, there are a small number of people who don't respond. That's a different conversation for a different day. But in general, people do respond. And yes, these medications have side effects. So what I would do is tailor to the functioning level of the person.
Okay.
By that I mean, so John, what is it that you want to do? Even though you're suffering with mental illness right now, and it could be suicidal, but what was the number one dream, hope that you always wanted to do? We all have that dream and hope when we were young. Revive that and said, okay, I'm going to help you fulfill that dream. Now, it could be someone who actively psychotic and said, I want to be a pilot.
Right.
Don't say, no, you cannot be a pilot.
Right.
That's the dream.
Yeah.
Okay, so you want to be a pilot. How do we get there? How do I help you from step A to step Z? And in a way, notice how your symptom get in the way of you fulfilling that dream. Here are the option to alleviate some of that symptom. And I know sometimes psychiatrists get caught with, well, you need to be on that dosage.
Right.
And no.
Yeah.
I prescribe based on the side effects profile and how people function, right? And there's strong argument and no, you got to treat the symptom have to go away. Yes, of course, but the person have to be able to tolerate the medication in order for you to get there.
That's good. That's good.
If they're not able to tolerate medication, what's the point in pushing the dose that you said is evident, right?
That's good.
So I've always gauged on how the person function. Because if you take a medication that the symptom will go away completely, but you're so drowsy and can't function, what good is that medication?
Yeah. Good. And that's what people say in their opposition sometimes, or just their frustration with medication is it just makes them feel terrible.
Yes. So it's become an art of negotiation. How do we prescribe, how do I give you medication to help you achieve your hope, your goal, in a way that it doesn't get in the way of you doing it, right?
So I would add to that.
It's complex.
Yes, it is. It is. But go ahead, John.
In the context of hope, through education, through support, through advocacy, through all that Dr. Chau, as an incredible resource, just articulated, I would say you lean forward in expectation and hope that you're doing all that you can. You continue in advocacy. You add to that, and I share this with every class that I co-teach, how do I cope in mental health journeys? Through prayer. My faith is the foundation of my coping strategy. So prayer should be continuous. And then I can think of so many examples. And one particular dear friend who I think you know as well, who goes by the first name David, is an example of someone who struggled for a number of years and whose family struggled with him. And a light bulb went off. Something changed at some point in that struggle. And David is one of my heroes in the mental health journeys of folks that I know so well. So HOPE, it continues to be a powerful word that's always effective.
Yeah.
So can I say one thing that I still hear people talk about it, and I get very emotionally upset when I hear people talk about it. And the statement said, do I have to wait until that person hit bottom? There is no such thing as hitting bottom.
Thank you.
By saying that, did you feel? Can you feel how unsympathetic, how cruel that is for someone to say, "Oh, you have to wait until that person hit bottom"? There's no such thing. There's no such thing at hitting bottom, right? So you gotta continuously giving people's hope. That's the best way to do it, right? The person who hearing someone said, "Okay, I'm gonna wait until you hit bottom," well, that is so defeating.
That's such a controversial. I mean, if there's a controversy again that I hear some things over and over and over, and one of them is this, I don't know what to do when my loved one won't respond. That one comes up over and over. Another one is, I don't know where to go for help. And then this one, because we're given conflicting advice, honestly, and particularly I think when there's a substance use disorder involved, and it's such a dance, between knowing that you can't force someone to get better, but like you said, there's the other side of the coin, that idea of hitting bottom. I don't know. I've noticed many times it doesn't seem to be that there is a bottom. Sometimes, especially when there's severe mental illness, the bottom may actually mean death. I mean, hitting bottom may mean death, and I don't think there's any of us that would want that for our loved ones. And so, just talk to me a little bit more about your understanding, from your perspective, about that dance between I can't make someone get better, I can't make someone get it. I can urge them toward it, but then this concept. Just talk a little bit more about that.
So from a loved one perspective, number one, self-care is so important, and I'm hoping we're going to talk about self-care, right?
Go ahead.
That
you can bring it up
image,
right now.
Yes.
Go ahead.
That image that you talk about when we fly, right? Put the oxygen mask on you first before you help someone else. That is so true and so good. So you need to take care of yourself first, right? And then take care of your loved one.
Yeah.
I think sometimes expectation don't match between the family and an individual living with mental illness.
Huh.
Family would say, I want you to get better. So you want me to get better then, or if I don't get better, then what? Right? It's we almost put an equation to it. If you don't get better, then I'm not going to support you. But if you get better, then I'm going to do this.
Yeah.
We all know this. From a religious point of view, God doesn't have that equation for us.
Yeah.
He loves us unconditionally.
Yeah.
I think, in a certain way, that's what we ought to do. I love you just because I love you. And you get better, meaning not that you completely, let's use substance. Stop using substance. But you can do less tomorrow compared to today. And then that little less can help you function better. I think it's all boiled down to what is it that the individual wants, right? And help that person realizing that dream is so important. And then you need to know what is it that you expect from that person. So if the person smokes 20 cigarettes today, do you want that person to stop completely tomorrow, or is it just 19 cigarettes tomorrow? Because if they smoke 20 today and they smoke 19 tomorrow, that's a victory.
Yes.
If we know anything about how difficult it is to get off addiction of any type, food, cigarette, drug, what have you, it's not easy because it's a brain disorder. It is not a behavior. I think that's the most important thing that we need to know. Even addiction, it is a brain behavior. It's a brain disease. It is not that person's behavior. Nobody wants that. You got sick. Something's changed in your brain structure, in your brain chemistry, and you can't help it. You need treatment and support.
So correct me if I'm, wrong. My understanding is that, everybody takes their first drink.
Yes.
On their own.
Yes.
Everybody smokes their, first bit
Whatever.
of marijuana, whatever. Shoots up for the. People do that in themselves.
Yes.
The first time or maybe a few times. And I think that's where it feels like it's gotten a little mixed up in our heads sometimes about, well, no, it's a personal choice. And I think, yes, sometimes that beginning of using is, but as my understanding is that at some point, for some people, the brain changes. The brain chemistry is altered, and a substance use disorder or addiction then comes into play. And at that point, it's not a choice as much as it is there's an illness that needs help in. Is that
That's correct.
Am I right on that?
So not everybody tried drugs, alcohol, cigarette, ended up having addiction to it, right? But if you have some vulnerability, whether it be genetic, whether it be because of the environment causes you to have that vulnerability, then you can develop addiction.
Yes.
By the time it's an addiction, it's a brain disease because there are there's chemical changes in the brain that you cannot and will not recover without intervention. An intervention here could mean treatment of any sort, right? All kind of treatment, right? People have got to stop blaming people with addiction that it is their behavior and it's a choice. It is not a choice. From a public health perspective, yes, you want people not to try it because we don't know who's at risk or who's not at risk. At least we don't, right? Some study will say, if you have certain factor, then you are more at risk than others, right? Being poor, living in a bad environment, have a genetic disposition, right? A family member with mental illness or addiction. Yes, those are clear risk factors. And from a public point of view, we need those family members less exposed to it and make having drugs, what have you, not so accessible, right? But we have to understand that when people get addicted, because they got a hold of drug, and it fulfills something, it fills in that piece. So people who so depressed suddenly use a drug that perk them up a bit. In their mind, number one, oh, this helps.
Right.
Secondly, it changes the chemical in the brain, and now they're addicted to that. And sometimes I hear people say, well, you need to get sober before I treat you. There's no such thing.
They go
If they
together.
use drugs to take care of their depression, now you tell them to stop, and then you treat them for their depression. What are they going to do in the meantime?
Right.
So treatment has to be simultaneously.
Simultaneous.
There's no such thing as getting sober than get treatment.
Yeah.
Right?
Let me add to that, if I could, that empowering loved ones, caregivers, with a bit more knowledge and insight helps them to have the staying power, the patience, the coping ability. And what I'm referring to there is that as folks are going through their journey with a mental health condition, with a substance use disorder, and maybe both, the recovery doesn't happen in a day or a week or a month. And the recovery is at the pace of the individual. Referring back to the NAMI curriculum as well.
I think you like that curriculum.
I do. I found some benefit
I
in
like it too.
and I
Good
like
stuff.
giving it away.
It's good stuff.
I like it
Yeah,
too.
thanks. So we learn in these classes that there is a period of time and predictable milestones in a person's mental health recovery. And that it's so important not only to understand that, but to respect it, so that when our loved one doesn't recover at the pace we want, when there might be an occasional relapse, what we perceive as a relapse, we can continue with hope and support because the path is pointing in the right direction. It's so essential to have that understanding, to be able to be an advocate and to be able to cope ourselves.
If you're interested in this particular aspect of mental illness, where mental illness and substance use disorder come together, on Thursday, we're going to be talking with a friend of mine, Nate, who is the National Mental Health Director for Celebrate Recovery. So we'll be talking about dual diagnosis in just a few days, so you want to tune back in for that. But as we kind of close up today, my friends, just quickly, what is maybe one thing that's happening in the world of mental illness, and you can pick which direction you want to go, that's giving you hope that this is not just, there's so much pain, there's so much sadness, there's so much loss and grief that accompany mental illness, but we want to leave everybody with just a little piece of hope, of something that's giving you hope as you work in the field that you're in.
Well, I might start. Thank you. There's so much that I'm hopeful over, but let me start with I'm hopeful over the reduction of the stigma of mental illness. It is perhaps the single largest barrier toward understanding, toward acceptance, toward effective treatment, not just for family members, but for peers with a diagnosed mental health condition. Because today, Kay, you've hosted this Facebook presentation, and we're talking about mental illness in an open, unveiled way, we have incrementally chipped a bit more against the barrier of stigma.
Yes.
As we reduce that barrier, it's going to open up a world of possibilities for our loved ones and for ourselves to really get the kind of effective, meaningful treatment that doesn't have this huge obstacle that really gets in the way. Gets in the way generally, and certainly for some cultures, it's an even higher barrier than for others. So that's my hope, one of my many hopes.
I like that.
For me, I think the fact that we have this conversation is very important. The fact that all over the world, people are beginning to talk about mental illness and addiction, right? All you need to do is just go on the World Health Organization website, and there's a lot of information in mental health and substance use disorder across the world. But in America, there's a huge movement now in talking about wellness from a less stigmatizing angle.
Yeah.
How do we promote the next generation of emotional wellness? That's important, right? Because purely from a federal point of view, all the agencies now, we recognize that treatment is effective if you want treatment. Prevention is really do work
Sure.
if we have enough funding to do the prevention piece, right? prevention and early intervention, and that people do recover.
Yes.
That's the most important piece,
Mm-hmm.
right? Everywhere you look around, there are people who are living with mental illness, who live with addiction, have recovered, and continue to recover because it's a journey.
Yeah.
It doesn't have an
Right.
end date,
Right.
right?
Right.
For me, I still in my recovery journey, and if we recognize that, then I think we're able to give folks hope that they're not isolated, they're not alone, and that nobody care about them.
Yeah.
Because I think there's a lot of people who care. The fact that you host this,
Yeah.
this is really, really good.
Mm-hmm.
I'm so hopeful.
Well, one of my hopes is just knowing that there are really good people like John Leyerle and Clayton Chau who have invested their lives in not just caring for people who live with mental illness, but looking for solutions, looking for ways to connect people to resources, looking for ways to connect people with hope. For me, that makes me smile because I so often felt alone in our journey with mental illness, to know that there are such good people who are investing their lives gives me hope. So thanks for joining us today. Hope to see you in a couple of days.